Nafanya kazi na World Vision katika idara ya Child Protection, ulinzi wa watoto. Na mambo ya child pregnancies imekuwa challenge sana katika kaunti hii ya Pokot, especially wale mashinani ambapo ukitembea kwa mashule unapata a very small percentage ya watoto wamereport back to school. Na hiyo imekuwa changamoto katika kaunti mzima na imelemeza sana masomo ya mtoto msichana. Na sisi kama World Vision tumeweka mikakati kadhaa ya kuhakikisha kwamba mambo haya yatafika kikomo. Ya kwanza ni kuweka mikutano ya dharura kwa viongozi mbalimbali ili tupate suluhu, kwa sababu tunaamini kwamba ikitoka kwa viongozi mpaka kwa wananchi inakuwa haraka sana mwananchi kusikiza. Na pia tumewaita wazee ambao wanaitwa Council of Elders, tunatembea na wao katika vijiji kwa vijiji kuongelesha vijana sana sana wavulana ili waweze kuchunga watoto wetu wasichana, kwa sababu wao ndio perpetrators wa early pregnancies. Na wazee wakiweza kuongelesha wavulana, wavulana wanachukulia kwa uzito sana ikitoka kwa wazee. Ya tatu ni kuongelesha wasichana wenyewe ya kwamba wanaweza kujizuia, ni ya kwanza. Ya pili, wao ndio ambao watasuffer the most, wao ndio ambao wanaumia zaidi wakati wanashikwa na mimba, kwa sababu masomo yao inapotea. Kwa hivyo tunawaita kuanzia class 4 especially during this holiday hadi class 8 and hadi form 3 kuwaongelesha na kuadvise, kuambia kwamba ni wao ndio wenye kifunguo katika maisha yao na wanaweza kukubali kusoma. Ya nne pia tunaongelesha wamama, kwa sababu mama uko karibu sana na hawa wasichana. Kwa hivyo tunaongelesha, tunawaambia kwamba waweze kuangalia watoto wasichana. Na changamoto zaidi ama kitu ambacho kimeongeza sana hali hii kuwa ni sherehe za usiku ambazo sana sana zinakuwa huku West Pokot. Kuna sherehe za silk za wamama, vikundi za wamama ambao wanafanya sherehe za usiku. Kuna sherehe za usiku za makanisa ambazo zimechangia sana mambo hii ya child pregnancies. Na hiyo ndio ya kwanza ambayo tunataka kumaliza katika kaunti hii. Kwa hivyo tunaongelesha viongozi na tunawahimiza hata siku ya leo ya kwamba sherehe hizi za usiku kama inawezekana ingeweza kufanywa mchana kidogo, ingekuwa afadhali. Ama kama kwamba watoto wetu wasichana wadogo wadogo pia wanakuwa kati ya mama ama wazee ambao wanaenda kuattend sherehe hizi. Kuna sherehe ya kimila ambayo inafanyika pia usiku. Sherehe ya kidanga ambayo mama wanaenda, kuna wazee na mama wanaenda kuruka. Hiyo pia ndio changamoto ama ambayo imechangia zaidi. Na tunajaribu kuongelesha jamii na kuwahimiza ya kwamba sherehe zingine pia zimepitwa na wakati. Na kama wanataka watoto wafaulu katika maisha, hiyo ndio ya kwanza ambayo wanafaa kuacha. Kwa hivyo kimila hizo na pia FGM ambayo bado iko, tunafanya mikakati mingi sana kuzuia FGM, kuongelesha watoto, kuongelesha wasichana, kuongelesha wamama, kujaribu kujenga safe house ambayo wanaweza kaa ili wajizuie kutokana na mambo hayo. Kwa hivyo sisi kama World Vision tumejitolea sana na tunajiunga na serikali, tunajiunga na county, tunajiunga na wanaharakati wengine kuweza kukomesha hali ya child pregnancies katika kaunti hii.
Tukienda kwa mambo ya taking the method, we call it preference rate, family planning preference rate for the adolescent. We are so low as a county at 8.6, and that's why you see it translates to that high pregnancy rate, because we have low preference rate of family planning. As a county also, we are doing very poorly when it comes to family planning due to so many factors. And one of the factor is cultural practices, because most of our people in West Pokot, they have not embraced this important issue of child spacing or family planning. And that goes by saying we have a task ahead of us as a county, as the Ministry of Health, and also as a nation, because West Pokot also contributes to the national prevalence rate. West Pokot also contributes to the national fertility rate, and also West Pokot contributes to teenage pregnancies. Okay, thank you very much. My names are Mr. Wilson Ngaren, West Pokot County Reproductive Health Coordinator. For those who doesn't know, the word reproductive health is a matter of issues to do with maternal, to do with child health, and so many other components inside there. We have around 9 components which I coordinate under my docket. And one of the components is about adolescent sexual reproductive health. That's key. And today we are here. We want to tell the people of West Pokot and Kenya that in West Pokot, our teenage pregnancy has risen up, especially during this COVID period. And as per our statistics, the current statistics that it was done, we are at 28.6%, that is the teenage pregnancies. And these teenage pregnancies move or goes hand in hand with the child spacing, or we call it kipanga maisha kwa watoto wetu. During this COVID period, it became also another challenge factor, because everybody was indoors, especially the first episode of the pandemic. All our children are at home, call it colleges, universities, secondary, so they are interacting in the community. And that's one of the factors that has made our county teenage pregnancy to go high. And without saying so much, just mine is to inform the stakeholders, because all this fight, we cannot fight alone. We can try, but without the resource envelope, without resources going to the community, creating awareness, advocacy to our people, to this young generation, we shall not go far. At least to budget, especially for these young people. We understand young people, they are the leaders of tomorrow. When we leave them the way it is now, we might not have leaders for tomorrow. So it's my great opportunity to maybe pass this message that let us invest on our adolescents. Let us invest on this issue of child spacing or teenage pregnancies to roll down or to move down or to be reduced from where it is. As we talk also, we are among the top 3 counties in this Republic of Kenya who has high teenage pregnancy rate, where every month we report Our HRIOs from the sub-county, they upload into the system. It generates automatically. And this data is segregated in terms of age, especially when they are reporting a mother comes for clinic, we just segregate in number of 10 to 14 years, 15 to 19 years, and even 20 to 24 years. So that data is uploaded in the DHIS monthly. So if you want to assess, you can assess at monthly basis or quarterly basis or per annual or yearly. It is just there. And that's where we get our statistics. But now there is that real survey, like now it was done, the census, yeah, of which we've not received the actual or the exact number. And also there are so many other surveys which have been done in between that it shows now exactly. Leave about now this, they are reporting those who are coming for ANC or antenatal care. But there are so many young people who are at home who are not coming for the clinic. And also that's part of our work, that we want to mobilize all pregnant women of whatever age to come for the ANC so that we can capture. Yeah?
You see, look at now the numbers that I'm talking about. Having a county at one particular point, over 800 girls are getting pregnant. Having a county where 8 young girls are sitting for the examinations in a space in an hospital is not something good to actually even talk about. It's a big challenge. It's one of the big menaces in the county and in the country at large. And according to KDHIS 2014, the survey that was done in 2014 says that 29% of the girls in Pokot County are currently having children or are childbearing. Basically, that is very, very huge. But moving forward, looking at the effects of COVID-19 in the county since March last year, when the pandemic hit us hard, averagely around 800 girls per month are getting pregnant, according to the Kenya the Demographic Health Information System that we get from the Ministry of Health, shows that over 800 young girls and adolescents are going into the facilities and they are presenting with pregnancies, which is very alarming. So when we look to March this year, that is close to around 9,600 girls presenting with pregnancies in West Pokot County, which is very alarming, considering the fact that these are young people and girls that should be in school, and most of them now are dropping out of school because of the issues of teenage pregnancy cases. Looking at the numbers, those are just those that are going to the hospital to seek services on ANC services. Basically, there are a lot of young girls and adolescents out there who are not seeking ANC services from facilities due to stigma. So there are a lot of those who are getting pregnancies, but the ministry has not captured this data. So looking at the numbers, trust me, it's very, very alarming. Looking at the way the current situations, COVID-19 is a big contributor, because there was a span of close to 6 or 7 months where these girls were at home, their calendars being disoriented because of COVID-19, and now those are just the fruits of what we are seeing. Girls, around 8 girls sitting the examinations in the hospitals because of pregnancies. During the KCPE, there were quite a number of girls who did the examinations in the hospitals because of teenage pregnancy. So basically, this is actually talking on a point that it's giving us a vision that, look at what was happening. If they could be in school during the COVID-19, then probably this could not be happening. So I think this is something that we need to look into it. Also, another cause is, the adolescents' uptake for family planning is very low in this county, and actually is receiving a lot of heat and heated debate coming from a pastoral community where the issues of sexuality is not actually discussed openly. It's seen as a taboo, and a lot of decisions are made by the leaders, political leaders, cultural leaders, and families and community, gatekeepers. So you find that most of the adolescents do not make their own informed choices to ensure that they actually take this family planning. Now, we've been on the forefront in championing for the issues of reproductive health, with a major focus on adolescent sexual reproductive health. Through the support of our partners, we've been able to actually, give information, comprehensive sexual education that is friendly and adolescent friendly to these adolescents on the need for understanding their sexuality, understanding the need for family planning and reproductive health services, and we've been actually conducting radio talk shows. We've actually conducting meetings with adolescents. We're actually conducting online dialogues to chart a way forward. We've also been bringing together stakeholders from different sectors: the Ministry of Health, the Minister of Children, the media, the Ministry of Gender, the Department of National, the issues of where the police are coming into. So we have tried to actually come together and do advocacy so that the duty bearers are able to take responsibility of providing actually correct and consistent sexual reproductive health information and services to these adolescents in West Pokot County, so that at some point they're actually not getting away or being taken advantage by what we call teenage pregnancies in West Pokot County. A political leader, a leader who is being entrusted by the community, talking about people should now start, getting pregnant because we need numbers as a community, which is a very misleading, statement coming from a decision maker. Because looking at the total fertility rate of this county, we are talking about 7.2. That means that every woman in this county given babies, it means there are around 7 to 8 babies. If you divide all the children in the county and all the women in the county of reproductive age, it means every particular woman in this county has 7 kids. That is what we're trying to talk about, which, looking at the poverty index of the county, looking at some of the social amenities that are not available as a county, that is very alarming. If we want our community members to increase these numbers and tell our women and our girls to get pregnant because we need numbers, because of resources which are not even there. So it's very sad to hear that. And the political space and the political leaders in this county have a role to play to ensure that we have a sustainable population, a sustainable community, that the resources that are coming from the equitable share and the resources that we are also making as the county can be able to actually improve the lives of our people. So looking at such, I would like to urge the community members not to uptake the messages that are misleading from the community, because and to get the correct and consistent reproductive health and family planning messages from the Ministry of Health, because they're the ones who are professionals and the information about the issues of family planning, the issues of childbearing, pregnancies, among other issues. So our leaders, please let us not mislead our community members. Let us inform them. Most of our leaders have 1 or 2 children who they are running, but they want our community members to have a lot of them. So let us try as leaders, political leaders and duty bearers, to actually inform our community on the issues, the benefit of family planning, number 1, and then the disadvantages of having children that are unwanted, number 1, and planned, number 2, and number 3, children that we cannot take care of.